let me share my screen. So I hope everyone can see that. So I was asked to talk a little bit about how we can live better with COVID. So that's what this is going to be about. And the key really is adaptation and learning. So first, to kind of underscore what people have said, people are acting as if the pandemic is over, but COVID hasn't gone away and it isn't going away. This is just a plot showing the different variants in England over time. So you can see there was the original variant. Then we had the alpha wave in the winter of 2020, 2021. Then the delta wave, which started about a year ago across Europe till December, when Omicron was over. And then people thought, okay, well, it's Omicron, but then another variant of Omicron, BA2, took over. And then we have, right now, growing in England, Omicron variants BA4 and 5, which has caused a new wave in South Africa, and BA2.12.1, which is causing a big wave right now in the US. So they're growing. So it's still not over. In fact, Omicron is spawning many subvariants, and many of them are fitter than its original. And there's this kind of idea that the virus is evolving to become milder. That's not true. So firstly, it isn't evolving from itself. So, Omicron didn't come from Delta, and Delta didn't come from Alpha. So it's not as if the different variants are progressions that are going to a certain place in time. That's just not happening. And secondly, they certainly haven't been getting milder. So Alpha was more severe than the original virus, and Delta was more severe than Alpha. And now Omicron was milder than Delta, but not actually milder than the original virus. And that was a random event. So, this is from a paper in, I think, the New England Journal of Medicine, came out a few months ago, saying, the viruses do not inevitably evolve towards becoming less virulent. Evolution selects those that transmit the best. Now, when you have something like COVID, where most transmission happens either before someone gets symptoms or when their symptoms are really mild, there's absolutely no evolutionary pressure to become milder, right? Because it's already passed on by the time you get really sick. The government virus advisory committee called NERVTAG said, the fact that Omicron has milder symptoms is likely a chance event. And the next variant to achieve global dominance is likely to be at least as bad as previous variants. So we can't count on things continuing to get milder. So we've got new waves coming. We do now have highly vaccinated populations. We also have populations that have had a lot of previous infection. And so kind of a scenario where you're seeing this kind of overwhelmed healthcare systems, or the kind of deaths that we had, particularly in the alpha wave in 2021, we're not likely to see that, but they still cause a massive amount of disruptions because it's just so infectious and people still feel ill, right? I don't know how many of you have had COVID after vaccination, but most people still feel pretty ill. And that causes a lot of disruption to your economy. In the UK, there have been several waves where, lots of flights have been cancelled. The NHS was struggling as they had record staff absences from illness. Schools were struggling. In fact, some classes had to go online or be closed because so many teachers were off work. And in general, you're in a situation where you don't really want a lot of your workforce to be sick, right? At once, it's very disruptive. And this is where COVID is a lot more problematic than flu because it's a lot more infectious. And so once it's there, a lot more people will get infected in a short period of time. It also causes a long-term depletion of your workforce. This is from a plot from the Bank of England report in May this year. And they were just wanting to highlight that there's been a big increase in the percent of the British population that are outside the workforce because they're not looking for a job. And a lot of that is because of long-term sickness. And it's higher in women than in men. And the Bank of England specifically said about 320,000 people are currently off long-term sick and so can't work. They say it's a record high and especially sharp rise among women, and they suspect a lot of it is due to long COVID. And we know that long COVID affects middle-aged people the most, and particularly women. The UK has an infection survey, which is based on random testing that's been happening since spring of 2020. So we actually have been measuring self-reported long COVID, so symptoms that are lasting for at least 4 weeks. Since then, in a kind of random survey, which is, one of the few countries that's doing this, they're showing that currently there are about 1.8 million people in England living with symptoms after 4 weeks. But of those, 350,000 say affects their day-to-day activities a lot, so significantly sick with long COVID. We also know how long they've been reporting it. So almost 800,000 people have had this for more than a year. Almost 250,000 people have had it for more than 2 years. People infected in the first wave are still feeling ill from long COVID. And we know that this is still happening in highly vaccinated populations. So this is just by variant. So you can see just since Omicron came in December, by which point, 80-90% of the population were fully vaccinated, about 40-50% of people who've been boosted, that you still had 438,000 people getting long COVID with Omicron. Now, yes, the individual chance is lower, but because Omicron is so infectious and affected so many people, you still end up with really significant numbers of people being affected. And this isn't just a problem in England, right? It's all around the world. The America particularly is also really worried about a long-term labour shortage due to long COVID. Right, so having kind of set the scene saying that COVID is going away, how do we live better with it? So absolute number one is clean air. The one thing that we have learned over this pandemic is that being outside is much, much safer than being inside, right? Almost all super spreading events and almost all transmission happens in indoor environments. And so what we really want to try and do is bring the air quality that we have outside inside, right? So in the same way that we did mass efforts to improve water in the early 20th century, in the way that we spent massive effort and infrastructure to bring electricity to people, to bring vaccines to people, we should do the same thing to bring indoor clean air to people. And there are lots of different ways of doing it. So it depends on your space, where you are, who's in the building, how it's being used, but it's kind of natural ventilation. So that's literally just opening the windows, where what you're doing is you're replacing old air that has infected aerosols. So these really small droplets of aerosols, and they have the virus inside, and you breathe in those droplets, and that's how you get infected. So you can open the windows and it refreshes the air. And so you're constantly kind of refreshing the air and taking those infectious aerosols out. You can have mechanical ventilation, which mechanically move fresh air in and stale air out. So in new buildings, most new buildings have good mechanical ventilation. One thing that I think is a really practical thing that lawmakers can do is to make sure that building standards say that every single new building has really, really high standards of mechanical ventilation. You can use filtration where you don't have good windows, where you can't mechanically move the air. And what that does is it particularly filters out aerosols, those little particles that have the infections in. That's called HEPA filtration. Or you can sterilize things. So that is, you actually just kill the virus inside aerosols, normally with UV light. There have been a lot of research on this recently that's invented new forms of UV light, ultraviolet light, that are not harmful to humans, that you could use in big spaces like canteens, like gyms, places where it's not practical to use filtration, and you can't always have a high enough level of ventilation. So that's really important. And there are more and more studies now showing that this is just really cost effective. So this is one just looking at HEPA filtration in a kind of an example kind of medium-sized restaurant in New York, and just showing that even under really low prevalence of COVID, far lower than we have anywhere in the world right now, HEPA filtration is cost effective in preventing transmission. And the other benefit of clean air, by the way, is that it works against any variant, it works against any airborne disease, and it also works against things like pollution. Right? So it's just a public health good over and above COVID. Oh, and just one more thing on ventilation. It's one of those things where there is no loss of anyone's freedom in providing clean air to people, right? There's no trade-off between individual freedoms, public health. It's just vaccines, really important. We know that vaccines are incredibly effective at reducing severe illness and death, but less effective at reducing transmission, although they help a bit. So you really want to keep vaccinating as many people as possible, including children, including vulnerable populations. We saw in Hong Kong that they had a dreadful Omicron wave because so few of their over 80s were vaccinated. You also want to vaccinate internationally, and I think we've really failed on this as a world. And it's not just to protect those populations from severe illness, but also the variants arise more easily in unvaccinated populations. So it's just a benefit for everybody if we can vaccinate. And we also need to start investing in new vaccines. We've become a little bit kind of fixated on the mRNA vaccines, Pfizer and Moderna. And they just haven't proved long lasting enough. And so there's a lot of call now among immunologists that we have to keep investing in vaccines that actually prevent transmission and last longer, because we can't get out of this pandemic. Our current vaccines aren't going to be able to do it, but a new generation of vaccine might. Surveillance is number 3. So locally, in your own country, do not abandon testing. If you abandon testing, we're starting to do that in the UK, you become blind to what's happening. We should be adding COVID to all the routine public health surveillance that we already do for other diseases and flu. Internationally, to continue supporting surveillance. So one of the things that worked extremely well over the pandemic is they built an infrastructure for sharing information on the sequencing of COVID so that you could look for new variants and understand very quickly what the potential impact of them was. That has been outstanding, and we need to continue it. And that's not just for new variants of COVID, it's for entirely new diseases or new outbreaks of existing diseases. We're seeing now that there's a monkeypox outbreak in many countries in the world where you don't normally have monkeypox. People have learned from the COVID pandemic on how to share information, and they've sequenced the monkeypox cases in record time, and it is already feeding into how countries respond. So it's really, really important that we keep funding international surveillance. Number 4 is long COVID and other long-term impacts. So I already spent some time talking about long COVID and how important it is. It hasn't typically made it into policy decisions in countries because people aren't measuring it, right? And it's not as easy to measure as a hospitalization or a death. Its impact isn't as obvious as a hospitalization or a death. But in the long term, it's going to make your population sicker and your workforce smaller, right? So countries need to start counting it, and they need to start including it in policy decisions. And we also need to invest in prevention and treatment, right? There's no known treatment for long COVID. We don't fully understand what it is. It's likely that it encompasses a few different types of response to the initial disease. And it has not gone away with vaccines. People hope that vaccines would reduce it. It reduces your chance of getting it, but once you have it, it's just as severe. There was a new paper that came out in Nature on that just last week. And from the UK data, about 8% of triple vaccinated people still go on to develop long COVID if they get infected. So it hasn't gone away. And it's not just about long COVID, it's also about longer term impacts. Again, we're seeing a lot of evidence coming out, particularly in the States with their Veterans Affairs data set, which has millions of people in it, of 1 year elevated risk of heart attacks, strokes, blood clots, all-cause mortality of people who have had COVID. And we don't fully understand those impacts, but they're still there. And again, it's going to make your population sicker in the long term. Number 5 is to invest in health systems. So I think, every country has had times when their health systems are really struggling. And we've also seen, certainly in the UK, that some hospitals have really struggled with spread within hospitals of patients and staff getting it from each other. So we have to protect healthcare environments from airborne transmission. We have to invest in staff. Many staff are burnt out and traumatized from 2 years of the pandemic. And we must forget about social care and the vulnerable adults in long-term care facilities, and also the staff who look after them, who are often of the more vulnerable staff, people living in more deprived areas who aren't paid enough, who can't afford to take sick leave, for instance. So we have to kind of invest in that whole system. Number 6, this is the second last one, is address inequalities to build a resilient population. Now, this is a difficult thing to do. You cannot do it immediately. In the long term, it's really important. The most disadvantaged communities, and I think this is common everywhere, have been more exposed to getting sick through the kind of jobs that they do. They're less likely to work from home, more likely to be in public-facing positions, particularly things like transport, teaching, and so on. More likely to live in poor housing or overcrowded housing, which we know is a risk for getting infected, or multi-generational housing, which often means that older, more vulnerable people are more likely to get sick, and also have less access to green spaces, so less access to the places that we know it's safe to mix. The people are more likely to mix indoors where it's unsafe, and so you have all these different factors creating higher exposure. We know that children living in more disadvantaged communities have had their education much more disrupted, much less able to work from home when schools were shut, and are now much more behind their more well-off peers were. We know disadvantaged communities have been more susceptible to getting really ill and dying, largely because of poor existing health, and more susceptible to long COVID as well. So all together have kind of been this perfect storm at disadvantaged communities. And it's no accident that countries lower inequalities have done a lot better. So, for instance, many Scandinavian countries. So investment in this will improve the resilience of those communities to COVID waves, but also to other diseases too. It's just a good thing to do for your public health in general and your workforce, right? There's economic reasons to want a healthier population. And the last thing is to plan for waves. The previous things, they will help reduce the size and scale of future waves of disease, but waves are still likely to happen. And so countries need to have a plan for how you deal with them through public health measures, such as, encouraging home working, high quality mask wearing, and it has to be high quality mask, FFP2 and above in public spaces or elsewhere. Thinking about self-isolation and contact tracing, boosting vaccines. When are you going to trigger those? Under what circumstances? How are you going to communicate it? How long is it going to be in place for? And so on. You cannot always react, because then you'll be too late. And we've seen that over and over again, that people are reacting too late. So you need to have a prospective plan. It needs to be well communicated, and you have to bring your population with you. And you're seeing now that some countries are saying, as they relax measures, we're relaxing measures, but if we need to, we'll put them back. And some countries like the UK are saying, we're never, ever going to do it again. And then when they backtrack, it's much more difficult. So just to finish off, we do have to learn to live with COVID. I think, the time for zero COVID is now. Perhaps there was an opportunity in the summer of 20 to get there. That's gone. But the key word is learning, right? We have to learn to live with it. We know so much more now about what works and what doesn't. So let's use that knowledge and reduce the impact of future waves instead of pretending that the pandemic never happened, which seems to be what they're doing right now in the UK. So I will end there. Thank you.